Primarily the Coleman Professional Services Suicide Prevention Programs stem out of the Coleman Access Office. And that office is our 24/7, 365, every day of the year service that we have for anybody in Portage County that's having, maybe not just a suicide-related problem, but any kind of mental health crisis.
The suicide prevention, we do a lot of that now, but to be able to train the people to be able to maintain a 24-hour helpline and provide that right now service, which people who are suffering from mental depression need, you can only do that with funding.
I feel that the involvement Coleman has in suicide prevention and education here in Portage County is quite possibly the most important thing that we do. I think that any of the families that we've worked with would agree.
The suicide rate has been stable for I don't know how many years in the numbers, the surveys that we've taken, but it is the third leading cause of death for the 15 to 24-year-olds, and that is unacceptable. It's extremely important to have people available at a time of crisis.
The way that Coleman and Coleman Access talk with people about suicide really is the biggest thing about how we assist them. A lot of people are scared to talk about it. Family members are scared, friends are scared. There's a lot of myths about, you don't talk about it, you don't want to say anything because they'll do it or they'll think about it more. And we go through special training to know that they're myths.
And to know that there is a place that they can go 24 hours a day and receive help is extremely, extremely important. And it's a value to the community that I can't even put into words. It's just so important.
The Kapling Apartments originally were 2 buildings on this site. We had one house that served 4 single adults and an apartment building in the back that had 5 apartments that were 1 bedrooms. And they were in a very bad condition. They were just a very old housing stock, just in really rough shape. So we had an opportunity, we got some money from the Ohio Department of Mental Health to start the project. And the idea was that we were going to raise those 2 buildings, move everyone out, raise the 2 buildings, and then build something that was brand new. People can live in these apartments if they have a severe and persistent mental illness and if they're also homeless. And it's a strict standard of homelessness developed by HUD that says that they have to be either in a homeless shelter of some sort or living in housing that's not meant for human habitation.
I think she could tell that I was really down on my last. I was just like, something's got to happen here. And when she told me that I was going to be moving to the new apartments, I was like, gosh, finally. It was like a relief. It was like a burden being lifted. And because I had been, at that time, I had been homeless for about a year. And so I was not sure where I was going to be living at.
Having stable housing is the first step in recovery. It goes back to high school psychology class when you learn about Maslow's hierarchy of needs. And without food, shelter, and clothing, you can't get higher. You can't improve anything else in your life unless you have those things stable.
Look at myself, and I wish you could have seen me in the past and how I talked and the basket case I was. And I couldn't even put a sentence together. I just wish you could see a before and after. But I would definitely tell you, I've come a long way, and I appreciate, the fact that I have a place to stay, and the effects that it has had on my life and the benefits that it has had on my life is just unbelievable. It really is unbelievable.
Every penny, every nickel, every dime helps, and whatever you can give, please give, and I can assure you that it will be used wisely.
I would appeal to folks to give, and to give generously, to help this great generation of folks to live their best life, to live the best quality life that they can.
These donations are extremely important to the ongoing operations, and most importantly, there's nothing to capitalize on projects like the Walter Kapling apartments or the adult day endowment issues. There's nothing to support people with dementia in those cuts of providing adult day care. They can't afford it, so we're able to use, fortunately, donated funds from the Coleman Foundation.
It has a great impact on you. Stability, comfort, you know, and it gives you a peace of mind. And all those things are very important. They're small things, but they're very important. So the investment is definitely appreciated.
I would fear for those individuals who are scared and hurting so much and would then honestly be told, well, there's no place to call. I would fear for them, and I would worry about them as a community and on a personal level if we're not able to continue these types of programs and enhance them and expand them in every possible way we can.